I think you are skirting around the bush, that maybe you're referring to the general welfare clause, and I hope that's not what you're doing, because that is probably the most abused clause in the entire Constitution. That was simply a preamble to the enumerated powers, and I know a lot of people have said they wish the government would state more in the Constitution, or excuse me, our founders have stated in the Constitution what they could do. But the main thing was getting what the federal government could not do, and I feel that this is just head down a road more of things that they should not and could not be doing.
Well, one of the things that I've attempted to do under the 10th Amendment is drive as much of the responsibility for this at the state level as I can in this legislation. For example, the exchanges are going to be run at the state level. They're not going to be federal exchanges. They're going to be state exchanges. Another distinction is this is not a government program. This is not a government program. It will all the policies will be issued by private insurance carriers, just as they are today in the private market. There's no government insurance company involved in this, so it's not a government program like Social Security or Medicare, which truly are government insurance programs with the government not only collecting the premium, managing the accounts, and paying out the benefits. So there are some major differences, and that's why I fought so hard against the public option or the Medicare buy-in, because those were Medicare is the single payer plan. There's no doubt about that, and extending it has consequences that I didn't agree with. And when it comes to the public option, that was a scheme to create a public or robust government-run insurance operation back here in Washington, and I fought that as well. So I think we fought back against some of the issues and the concerns that many Americans have. And what I think we also have is a lot of people who got turned off by the original version of this and have never either followed the changes or can't change their mind about the changes because they were so poisoned at the beginning.
47 past the hour. Here is Dave for the governor. Good afternoon, Dave. Go ahead. Senator, I should say.
You say Dave?
Yes, go ahead.
Oh, thank Governor. Thank you for being there. Or not, Senator, I mean.
That's all right. I'll answer to either.
But my question is, I have a company in Omaha. We employ 25 people. We already provide all their health care for them and their family. Why should we have to pay more taxes?
Well, I don't know that you do pay more taxes.
You're telling me we're not going to pay more taxes?
Well, there's no tax related to your business.
There's no tax. We're not. My insurance premiums or taxes are going to go up as a result of this bill. Is that what you're saying?
Well, I can tell you this. If we don't have this bill, it's most likely that your premiums are going to go up. So I can't tell you.
I've called you guys many times about my premiums going up. You haven't done anything about it. Anyway. My question is this. My question is this, Senator. Are my taxes as a small businessman going to go up, or are my premiums going to go up as a result of this bill?
Period. I do not believe that they will.
Period.
I don't believe that they will. Well, no, I don't. The reason I can't answer that 100% is I don't know who your carrier is.
Go up or not?
Well, listen, you want me to explain, or you just want to keep pushing me here? Let me explain. I don't know who your insurer is. I don't know what your premiums, where your premiums have gone up in the past. I don't know what the loss experience is, so I can't tell you. What I can tell you is that nationwide and in Nebraska, the premiums have increased at 10% per year. Now, maybe yours are higher or lower than that, and maybe they haven't gone up for a year, or I've talked to others who had their premiums go up 15%, 20%, or higher. And so there isn't a way I can tell you that. What I can tell you is that this is not designed to increase your premiums. It's not designed to increase your premiums or increase your taxes. The business tax credit starts 1 year earlier, but this is not something. This is with firms with average wages up to 25 instead of 20,000, and some others. So there is a small business tax credit in 2000. It's a tax credit. Other than a tax increase. So I may be able to tell you that your taxes will go down. I hope that's the case with tax credits.
Move on
So
to...
we're trying to respond to your concerns about increasing taxes, Dave, but at the same time trying to take care of the insurance needs of people without insurance without disturbing the insurance to those who have it.
Less than 10 minutes left in our show, Senator. We move on to Omaha, where Scott is on the line. Hi, Scott. Go ahead.
Hey, Senator, how you doing?
Great, Scott.
Hey, I got a couple of questions for you. One, why would you vote for a bill that 67% of your constituents were against? And
The poll is let me answer the first one first. There's a poll that's out there that I think is skewed. I don't know that it's 67%. I've seen polls that I think are more scientific that would put it closer to 49, 51, or 50-50. I don't know that, and nor does anybody else. I don't make my decisions based on polls. I know that there are many people who are very supportive of what I've done, and a number of people who aren't supportive of what I've done. But at the end of the day, doing nothing is not an option. Now go ahead with your second question.
Well, I just see every poll that's been out in the state, it doesn't seem like anything's been under 60%. You know, so
that kind of says you haven't seen all of them, Scott, and I haven't seen them all either. But I have seen polls that I think have been scientifically done that would show it's closer to 50-50.
In Lincoln, here is let's go to Melvin. Melvin, you're on the line with Senator Nelson. Go ahead, Melvin.
Oh, thank you, Senator, for taking my call.
Sure, Melvin.
Yeah, Senator, you have to know that the president and other senators and House members have stated that this plan is simply the first step in a single-payer, government-run plan. Knowing that, referring back to your auto insurance analogy earlier, bad drivers are people that you can have auto insurance, but being a bad driver is a pre-existing condition. You pay more. If we required auto companies or homeowner insurance companies to give everybody the same insurance plan, it would spread that cost around to everyone else, which is what exactly you're doing here.
No, this doesn't require the same insurance plan for everybody. This doesn't do that. It makes insurance available with choices so that people can decide what they can afford, what plan they want. So it's not a single plan for everybody. There's some guidelines that have to be met, as there should be, standards, but this is not a single plan. It's not a single payer plan. It's not going to morph into a single payer plan, but I could tell you that the government option, I thought, would, and the buy-in on Medicare is a single payer plan, and all you'd have to do is continue to extend that down from 65 to 55 as they proposed, and 55 to 50 and all the way down. And I thought that's not the case. So there's a lot of concern about what the bill was before rather than what it is now.
But how will you have private insurance when you are dictating in this bill what compensation insurance companies can give to their people? You're dictating the percentage.
No, I don't. There's no dictating compensation to people.
There is not?
No. No, if they want to pay their underwriter $25,000 or some number, they may do it. There's no minimum, there's no maximum here.
There's not, and the amount of the percentage of premiums that must go to claims is not dictated?
Well, that's a different story. That's a different story, but you know,
where do you have authority in the Constitution to dictate to a private company what they should pay?
The state laws do that now. The state laws do that now. There's nothing new about that.
Thank you for the call.